Welcome back, my friends. I hope you're having a fabulous weekend so far. This is Lindsay bringing you another job lead video. If you are new here, I post work from home remote job opportunity leads daily, so make sure that you are subscribed if you are not already. In the comments, you have been saying that you are looking for non-phone work and you have been enjoying the healthcare job leads that are not phone-based. So today I have for you 9 companies and jobs that are hiring in the healthcare field that are not customer service phone based at all. And if you stay with me till the very end, I have one that even provides computer equipment. As always, the links to all these positions will be in the description below so you can apply if something piques your interest. For my international viewers, unfortunately, all of these jobs are US based only. I am trying to work on a video specifically for my international viewers, so stay tuned because that is coming. First up, we have the trusted Mayo Clinic. They are looking for a remote operational analyst for their revenue cycle department. And so Mayo Clinic, if you don't know, is the nation's best hospital, and it's ranked #1 in more specialties than any other care provider. They are very well known. So this position that they are hiring for is to support the transplant billing and follow-up team. You will assist in solutions to enhance the effectiveness of operations through the enterprise revenue cycle. So this position performs research and troubleshooting of issues related to the scope of influence. Participants in project teams and complete assignments and tasks in a timely manner. You keep other staff apprised on the progress of your assigned task and any issues that you encounter. You maintain a high level of customer service given changing and competing priorities. You receive direction from multiple people while continuing to work on your assigned projects, and you will need to maintain knowledge of the current healthcare environment and understand an accountability for ensuring that the control environment is maintained because they want to preserve Mayo Clinic's standard of ethics. And so you need to be able to work with limited supervision. This is a remote work from home position. The qualifications are only a high school diploma or GED, and they would like someone with 3 years of relevant experience required. They do not specify what relevant means. They do prefer someone with associate's degree, and previous healthcare experience is preferred, but again, not required. So for compensation for this position, it is anywhere from $24.13 an hour all the way up to $32.59 an hour with no college degree required. So this is full-time, and it says hours per pay period is 80. And since there is 40 hours in a full-time work week, it looks like pay is every other week, and it is 100% remote. They do ask that applicants for this position be available Monday through Friday between the hours of 7 a.m. and 5 p.m. Weekend work would be as needed for special projects. So most of the time, this is a daytime job and not weekend work. The next 2 positions I have with you are both for HCA Healthcare. One is full-time and one is part-time for my people looking for part-time work. So this one that is full-time is for an overpayment analyst. It does say this is a remote work from home position, and it says, are you looking to work in an environment where diversity and inclusion thrive? So they are very interested in having a diverse workplace. They understand that different people and different cultures bring different things to the table. They are committed to providing their colleagues with the support that they need. They offer an array of medical, dental, and vision packages. Some of their other benefits include student loan reimbursement programs, tuition reimbursement, moving, mortgage, and real estate assistance. They match 401ks, and they provide an employee stock purchase program. So a little bit about what an overpayment analyst will do. It says in this role, you'll perform and validate discrepancy reason coding. You will initiate refunds of identified overpayments and resolve open discrepancies. So that's like overpayments is when the insurance company pays more than they should have based on the contract. contract that is in place. Monitor takebacks and initial refunds as appropriate. So when the insurance pays more, you will have to cut a check and refund the money. Review and resolve credit balances. You may have to accept phone calls and resolve patient concerns if they come up. You will research returned checks and take the necessary action. So you'll need to perform basic math. And the qualifications for this are just a high school diploma or GED preferred, but not required. So this requires no degree at all. And 1 year of related experience is required. So the same company, HCA Healthcare, is looking for a billing specialist PRN. Now in the healthcare world, PRN means as needed. So this is a part-time as needed position and not full-time. It is a remote work from home position, and they offer the exact same benefits as the other one: student loan repayment, health insurance, dental, employee stock options. So as a billing specialist in this role, you will resolve claim edits based on documented processes in the electronic billing system. You will communicate edit trends to your team lead, manager, or director. You will review unreleased claims daily in order to resolve and release to the payer. You will resolve requests in all designated billing queues. You'll complete secondary claims, and you will review the reports daily to post final bill coding changes and rebills as required, and then you will document that in the collection system. Again, this position says high school diploma or GED preferred, but not required, and 1 year of experience is required. Moving right along, UnitedHealth is hiring a claims clerk to work from home remote. And so it says you'll enjoy the flexibility to telecommunicate anywhere within the U.S. and take you on some challenges. So this position is full-time, 40 hours a week, Monday through Friday, and they want employees to have the flexibility to work an 8-hour shift anywhere between their normal business hours, which start at 5 o'clock a.m. and go to 5:30 p.m. And it says it may be necessary, given the business needs, to work occasional overtime and weekends. So as a claims clerk, you'll be responsible for supporting the intake of provider claims through researching the type of request, claims history, accurately routing to the correct adjustment department for completion. And so your primary responsibilities is update claims with the correct provider and member attached. Participate in meetings to share your solutions for questions or find error trends, and consistently meet established productivity, schedule adherence, and quality standards. And so what they require for this is a high school diploma or GED or equivalent work experience. So no degree is required for this. If you do have work experience, you do need to be proficient in Windows PC applications and have the ability to navigate multiple programs and learn new computer systems. And of course, the ability to work full-time Monday through Friday, 5 o'clock a.m. to 5:30 p.m. And it says you'll be rewarded and recognized for your performance in an environment that will challenge you. So it looks like they do provide performance raises. They do have some preferred qualifications, but preferred not required. And we spoke about this in another video. Microsoft Office, Excel, Word is used in the healthcare field as the main communications and document system. So it is great to have that experience. Now, as far as the requirements to work from home, they need you to have a dedicated work area that is separate from your living areas, because you will be having patient confidential information up on your screen. You can't just having anyone look at it. So you need to be able to go into a bedroom and shut the door where other people cannot see your computer screen while you are working. So that requires the ability to keep company sensitive documents secure. And it says you must live in a location that receives UnitedHealth Group approved high-speed internet connections. Satellite internet connections are not available to do this job. So as long as you have high-speed internet, you should be safe. I know these videos with multiple job leads can get very long and drug out, so if you are enjoying these healthcare positions, please comment down below and let me know, and I can do more videos like this. Or if you don't like this video format and you would rather me not do this, please let me know in the comments down below on that also. So next up, we have Blue Cross Blue Shield hiring a claims research specialist specifically for their Medicaid expansion, and it does say this opportunity is available for telecommuting or working from home. The claims research specialist is responsible for using knowledge to conduct research on complex claims and benefits issues and adjust the appropriate claims. This role identifies trend issues with claims processing and assists with front-end resolution to clear up concerns in a timely manner. So the essential functions of this job are to conduct in-depth research on claims and benefits issues requests received through the internal system. You'll review claim errors to determine if the system made the error or if a manual human made the error. You will document your findings, and then you will adjust or fix the claims per the benefits policies and procedures if necessary. You'll follow up with appropriate individuals to give additional information so that they can correct issues permanently. You will act as a resource and support internal departments for knowledge in issues and claims resolving. And you will process Medicare crossover adjustment claims and to determine if the adjustments are needed. You'll need to be able to research various specialized requests from CMS, which is the Centers for Medicare and Medicaid, and you'll complete requests generated from reports in various departments. So knowledge, skills, and abilities. You need good written and verbal communication skills, attention to detail, task and goal-oriented and focused, great problem-solving skills. This does require a high school diploma or a GED, but does not require a college degree of any kind, and it only requires 1 year of experience. And it says minimum of 1 year of experience. They will accept customer service experience, office setting experience, or related experience. They prefer claims processing experience, but you do not have to have healthcare or claims processing experience. They will take other experience as well. We are getting close to the end, I promise. So these next two positions I have for you are both with the same company, which is Conifer Health Solutions. I hope I am saying that right. The first one, I've had someone ask in the comments of another video specifically for payment posting jobs. This one is for a payment representative, remote work from home. And so this is with the payment posting and cash management department. And so responsibilities are to perform the payment applications functions within reimbursement and the cash management team. So essential duties and responsibilities are to perform manual and electronic posting functions for all managed care, commercial, and government payers for all patient accounts, including cash balancing and reconciliation of bank deposits. You need to maintain knowledge of insurance rejection denial processing and appropriately post those denials information for collecting and follow-up activity. You need to maintain daily cash logs, post payment corrections, payment transfers, payroll deductions, and then you need to be able to research and clear up any unapplied accounts and be able to reconcile bank and special accounts. So since I am in the healthcare field, so when insurance companies make payments or they decide they're not going to pay a claim, they put all of that information on what's called an EOB or a remit. And when they cut a check to a healthcare company, the check is for multiple patients, multiple accounts, all the claims that were billed within a certain time frame. And so all of that is broken down on that remittance. And so cash posting post the payments to each individual account, post any contractual adjustments, and they also need to post the denial information. So if the healthcare company didn't pay anything and there's no payment to post, there's a reason on that remittance of why they did not pay. They still have to post that in the system, because then that goes over to a claims specialist, denial and follow-up person, who then fights the insurance company or sees if they can change that decision. So that is kind of how things flow in the healthcare field. So payment posters are very important to get the process started for the flow of claims. So just like I was saying, on the flip side of that, the follow-up piece, once payment posting posts the denials, the follow-up piece is to follow up and try to fight the insurance company and get payment for things that were previously not paid. So they are also hiring for that position, and it is a denial specialist. And so some responsibilities of this is you will validate the denial reasons and ensure coding is accurate and reflects the denial reason. You'll coordinate with Clinical Resource Center for clinical consultations when necessary. You will generate an appeal based on the dispute reason and contract terms specific to the payer. This includes online reconsiderations. So sometimes insurance companies just don't pay a claim because they don't think it's medically necessary for the patient. So what you do is you have to file a claim reconsideration, and you have to, normally it's done in an online portal with a PDF document, you have to upload medical records and ask them to please reconsider payment on the claim based on this patient's medical history. So you'll have to follow payer-specific guidelines for their appeals. Blue Cross may require something different than UnitedHealth Group, and Humana may require something different. So you'll work payer projects as directed, and you'll perform and research to make determinations or corrective actions that need to take place for the claims to get paid. And you may occasionally have to escalate denial or payment variance trends to your leadership. So just know that some of the healthcare field, because they are in the healthcare realm, will require, even when you're working from home, a COVID-19 vaccine to be employed with them. That's a personal decision that you will have to make, but it does look like this company requires that. So as far as skills for the actual position, it says intermediate understanding of EOB, explanation of benefits is required. You need to know hospital billing. UBO4 forms is the actual claim form that is sent to the insurance company. Immediate understanding of CPT codes or medical terminology. There again is your Microsoft Office, Word, and Excel. As far as education, a high school diploma or equivalent. Some college coursework is preferred, but not required. And they would like 3 to 5 years experience in hospital business environment, billing, or collections. And of course, because this is a sit at a computer and work online job, you need the ability to sit and work for extended periods of time. Real quickly, next we have a credentialing office assistant. This is a remote position. This job posting does not give too much information, but I thought I'd throw it in here because credentialing is another part of the whole claims healthcare field process. So the responsibilities of this job are to produce reports, memos, and letters from a rough draft demonstrating an intermediate degree of proficiency in word processing spreadsheet applications. You need to make arrangements for credentialing supervisor related to travel, appointments, and meetings. You'll handle general clerical tasks like making copies, answering phone lines, taking messages. I'm not sure why that's in there because this is a remote credentialing position, and credentialing is mainly done online. So if you get an interview or apply for this, you may want to ask them how much phone work is actually required. It should not be much. You'll prepare and maintain files, and you'll maintain departmental lists. And so job requirements is high school diploma or equivalent with 2 years or more experience and administrative experience, proven computer skills. So they do look like they also require the COVID-19 vaccine. And last but not least, Performant is hiring a customer service healthcare support representative. And while this one is customer service based, it will require a tiny bit of phone work. But when I threw it in here, because when I was reading over it, it looked like the phone work was very minimal, just a tiny amount. It looked like maybe you would be making outbound calls. You're not sitting on a phone accepting calls all day long like a regular customer service rep. And they do provide computer equipment, and so I know a lot of people don't have a complete work from home setup and they are looking for companies that provide computer equipment. So I just thought that I would throw this one in here. So it says your essential duties would be to perform daily office tasks such as filing, recording, maintaining records, posting transactions, or other similar duties, mainly using a computer. You'll collect, review, and input data into the computer systems following client and performance policies, procedures, and instructions. It does say you'll answer phone calls and respond to internal inquiries, but that doesn't look like it's most of this job. You'll reconcile account information and balances. You'll review and process account media and correspondence. You may support and perform research of exceptions in data established workflows. And so it says you can assist in various account activities like inventory reconciliation, identifying and preparing adjustments for posting, processing refunds, and supporting account transition assignments and referral-based established workflows. You'll assist in reviewing the daily reports, and you may have to generate letters. And so required skills for this position are, of course, Microsoft Office, and then you need to be able to use Excel formulas such as VLOOKUP and pivot tables. That's all Microsoft Office Excel. Pivot tables are very easy to use. You must be able to work independently on assigned projects. Understand the healthcare field is desired. Ability to quickly learn. Ability to follow instructions. Ability to multitask. Attention to detail. And ability to effectively communicate verbally and in writing. So under physical requirements, it says that you must be able to meet requirements and perform work assignments in accordance with their company policies. Now right here it does say basic office equipment required to perform remote work is provided by the company. And so you'll need to be able to sit for 8 hours a day and consistently view a computer screen. So as far as education experience, a high school diploma or GED is required for this position, but no college degree is required. 4 years customer service or similar professional office support experience, and 6 months working with healthcare claims. That was a lot. If you have stayed with me through this whole video, I want to say thank you so much for watching. Please let me know if you like these healthcare positions or if you prefer something different. And as always, make sure you've subscribed so you do not miss another job lead. 2 videos will be popping up on your screen. One I picked for you and the other YouTube picked for you that you might enjoy next. Please subscribe and hit the bell icon so you never miss another work from home or money making video from me. Thank you so much for watching, and I'll catch you in the next one.